Good morning. Today's theme is sickle cell disease. We're going to be talking about current medical and mental treatments as a part of these professional education presentations. I'm here. I'm honored to be here. I'm Cynthia Washington Williams. I'm a licensed professional counselor, licensed triply in 3 states, South Carolina, North Carolina, and Georgia. I am a military and family life counselor, and I have been in private practice for over 20 years. My role today is to speak on the levels of mental health therapy as requested by Sickle Cell Services of COBRA, supported by Medical University, South Carolina Sickle Cell Disease Program. We're hopeful today that this presentation is going to benefit physicians, other professionals, support staff, patients, families, and our community. I wanted to provide just that short moment of silence because I truly believe that's what's happening as we think about mental health. The silence regarding mental health is deafening. It is a subject that is considered, unfortunately, taboo. It is misunderstood. And I think it's very important that we definitely break down the silence as it relates to mental health and mental health issues. Because as we know as a community, it's very common. It's common in our families. It's common in the workplace. It's common in our communities. It's common in our churches. We are dealing with the chronic situations regarding the pandemic. People are struggling with growing anxiety, grief, depression, substance use and abuse, and other mental health impacts. So I think it's important when we talk about mental health that at first we describe what is mental health. And I like to be very clear and simplistic. When we think about mental health, I want to give you an acronym. Normally we think of GPS when we're driving in our cars. When we talk about mental health, the acronym that I want you to remember is EPS. EPS. Emotional, psychological, and social. Emotional, psychological, and social. How we relate to people, how we respond to stress, how we think, how we feel, and how we act. EPS. So when it comes to mental health, I want you to think in terms of that framework. How are you or others around you handling the vicissitudes of life on an emotional level, on a psychological level, and social well-being? What causes mental health issues? That's really what's important. Well, it's influenced by a tremendous amount of risk factors. There are genetics, and the reason why this is important is because if you're dealing with a family that doesn't talk about mental health, or there are family secrets, maybe you are unaware of some of the genetic issues that occur or have occurred in your family. Life experience, the environment that we live in, the relationship between our brains, how our brains are wired, and mental wellness, the neurochemistry. And so having a risk factor actually doesn't mean that you're going to have an illness. There are people who live with mental health issues, and it affects them in many different ways. No two people are alike. You can use therapy, you can use tools. As we're talking about sickle cell, and I've been afforded the opportunity to work with a lot of sickle cell patients and their families. And so with therapy, I'm not the physician. The physician's role is important, but as a therapist, we want to help people be able to cope. We want to help people be able to deal with their sickness and how they can have the best quality of life. So when we talk about diagnosing mental health, we use what we call the DSM-5. And basically, it is a guide. It's a diagnostic and statistic manual of mental disorders. And so these are guidelines so that we can give people the most effective treatment for the common symptoms that they are experiencing. So I need you to know that mental health is treatable. Mental health is treatable. What stands out about mental health is that it's invisible. What do I mean when I say that? We know about heart disease, diabetes, high blood pressure. These, especially heart disease or maybe diabetes, they are essentially invisible illnesses. So is mental health. A lot of times with the military, I've worked with the military extensively, nationally and overseas for over 14 years. And a lot of times when they return, you cannot visibly see that they are experiencing a mental illness. Maybe they experienced something downrange and they now have a traumatic brain injury. And so it becomes very difficult sometimes when you say, well, how do you know that someone has a mental illness? What does mental illness look like? How will we know that it's time for someone to see or seek mental health treatment, seeing a therapist or seeing a psychiatrist or seeing a counselor? So we kind of want to talk about that today. Remember the acronym that I provided, EPS. What's going on emotionally? What's going on psychologically? How is this person? What is their social well-being? Think about your friends, your co-workers, and your family members. Do you know anyone that has a mental illness? How did people react to them? Some of the problems in the community is that mental illness actually has a stigma. And stigmas are not only in the community. I've also seen a lot of stigmas in working with the military. What is stigma? It's that attitude that someone is different in a way that takes away from their value as a person. We don't provide that stigma if someone has cancer. We don't provide that stigma if someone has diabetes. However, when it comes to mental illness, there's that stigma. Are you nuts? Are you mad? Are you crazy? Are you a lunatic? Are you a psycho? Why do you need to go to a therapist? Just this week in my private practice, there was a young man who stated, Ms. Williams, when I told my family that I was going to see a therapist, the response was, what are you going to see a therapist for? You can just talk to us. And he stated, I realized that the view of mental health in my family and in my community is not very well received. Why is that? I believe because there's a lack of knowledge. There is a lack of knowledge and misunderstanding as it relates to mental health. There are negative attitudes, misunderstandings, and the word prejudice, which means we prejudge. We begin to think of mentally ill people as not normal or maybe even dangerous, where the research is very clear that these people are not necessarily dangerous. So if we have these thoughts as it relates to the stigma, our attitude becomes an action. We avoid engaging, which means we never rewrite the script. I think it's time in 2021 that we rewrite the script. I think it's time that we remove the stigma from mental health. These words, sometimes we use as a joke. They're common in movies, but there's a problem with that. We definitely don't want to conduct ourselves in a way that will impede people getting the necessary help that they need. They're a drug addict. He or she is crazy. That's not something that we do with chronic illnesses. We don't do that with sickle cell. We don't do that with heart disease. We don't do that with cancer. It's subtle, but it's a powerful way that really perpetuates the stigma of mental health. And so today, like I stated, I'm really hoping that we will eradicate the stigma so that people can come forth. I use a phrase and I take it around me, take it with me around the world as I have been afforded the opportunity to counsel every branch of the military nationally and internationally. And I state, it takes people of strength to say, you know what? I think I need to talk to somebody. I'm feeling overwhelmed. I'm feeling like the wall is closing in. And definitely during this time, as we experience the pandemic going on over a year now, there are a lot more people coming forth saying, my anxiety is increasing. I'm being quarantined. I feel lonely. I'm struggling. And so definitely in this season, we have seen the numbers go up. We have seen adolescents come forth, a lot of males, females, and lots of families. And so I want to talk to you briefly about some of the reasons why I think there's such a stigma. Mental health throughout history has had a deep, deep root in misunderstanding. Actually, for centuries, and I mean centuries, there was really no understanding. How do we treat mental illness? People with mental health were removed and actually excommunicated. They were locked in mental hospitals. Representative Mack and I were discussing the hospital in Columbia. And so the shift really did not occur until around about the 1930s. When you think about that, it's really not that long ago. Sigmund Freud and Carl Jung, they actually developed theories about how we could help people with a talking cure, which ushered in a new era. Yet that move from institutions to actually outpatient treatment really did not take root until the 1960s and 1970s. Wow. So just ponder that a minute. So mental health issues have really been inundated with misunderstanding for a long period of time. And so no wonder one of the stigmas are, why would you want mental health treatment? Just a lot of times in the spiritual community, in the church community, just pray about it. Just pray about it. If you pray about it, all will be well. Well, how many of you know if you experience some sort of trauma, trauma will rest in the body. If you experience some sort of grief, you have to deal with it. And so a lot of times when I'm listening to people, I hear that they have really normalized a lot of the activities that are going on in their life. A lot of times people will say things matter-of-factly because they have been taught this is normal. You don't need to get help for this. And so as we begin to eradicate the stigma around mental health, I want to share with you some of the positive changes, and I want us to really think about how we can dismantle some of these misinformations and dispel some common myths. First of all, I think it's important that we talk about it. At the beginning, I provided a period of silence because I believe that not talking about mental health is deafening. So let's dismantle some of the myths. Mental health problems are a character flaw. Mental health issues are not something that someone can just get over or snap out, but it's also not a moral failing either. If you perpetuate this type of thinking, it can actually keep sufferers from seeking medical help. Honestly, I really am hopeful that we will begin to see that mental health goes in the same category of medical conditions, just like heart disease, sickle cell anemia, and cancer. Another myth, Ms. Williams, people with mental health issues are violent, they're unpredictable. Well, the research is clear. Only 3 to 5% of violent acts can actually be attributed to individuals who are living with a serious mental illness. People with severe mental illness are over 10 times more likely to be victims of violent crime than the general population. Another myth, it's not possible to live a normal life. Well, studies show that people with mental health problems can get better and better, and many recover completely. Recovery means that a person is actually able to live, work, learn, and participate fully in their community. Guess what? You are working alongside people who may have mental health issues or who have fully recovered. There are treatments, services, community support systems, and some of those I'll be sharing at the conclusion of the summary. And this myth right here, well, I don't believe that I can do anything to help someone with a mental health problem. But guess what? You can actually make a big difference. How? By learning about mental health, speaking out against common misconceptions, being supportive and refusing to define a person by a diagnosis. One of the things that I have learned to say is I will state that a person actually has a diagnosis. This may be a person with substance abuse disorder or bipolar, or this phrase right here, someone committed suicide. Instead of saying that, we need to use the phrase that someone died by suicide. Commit sends the message that it was a crime. And so I think if we can be very careful in separating disorders from people and diagnoses from people versus making it seem like it is, like I said, a character flaw. This will help and go a long way. So you may be asking, hey, help me understand. How can I help? Well, one of the ways that you can help is to be supportive. Find out about mental health. Educate yourself. Watch your language. Encourage dialogue. Let's take the Band-Aid off. Like I said, our silence around mental health is deafening. Let's start talking about it. Let's stop sweeping it under the rug. It is important. And in case you haven't noticed, a lot of people are dealing with it. And I think that when you talk about mental health, like I stated, it really is a medical condition, and it belongs in the same category as the other diseases that we talk about and that our community may be experiencing. Mental health conditions are not rare. They are not rare. A diagnosis is not an objective truth. It's actually a tool that we as professionals use so that we can help determine what's effective. For some people, realizing that their lifelong struggle with sadness, anxiety, addiction, etc., has its roots in mental health illness actually is an aha moment. Wow, so that's what's been going on. A diagnosis can be an important part of getting the appropriate treatment and support. We understand that getting to that place is not so easy. What's in the way? Well, like we said, it's a taboo subject. We just don't talk about that. Death and mental health are subjects our culture avoids a lot. Don't go there. What about embarrassment? It's none of my business. It might be embarrassing. Well, or maybe I could make somebody angry if I've misread the cues. I'm not a psychiatrist. What if I say the wrong thing? There can actually be confusion and anxiety about taking on the responsibility. But if you see something, say something. You're unsure of how involved you could get, just say, you know what, I'm concerned about you. This is what I've observed. That's your role. If you see something, you have a responsibility to say something. Yes, it'll probably make you nervous. Maybe you're unsure of what to do. Maybe you're uncomfortable. You see someone is struggling, but you're not sure how you should handle it. Be sensitive to the need for privacy. If you are going to talk to somebody about something that you're seeing, do it privately. Don't address people in front of others. Show your concern and support. Just let them know, I care about you. It seems that you seem to be distracted. You seem to be very emotional. Remember the acronym that I gave at the beginning. It doesn't seem that you're as focused at work. You seem to have withdrawn. And so what I'm sharing are some things that you might experience, some things that you might see in people that would lend the notion that, you know what, maybe something's going wrong. Maybe something is going on and this person might just need some help. Maybe you hear somebody expressing feelings of worthlessness, guilt. Maybe you see somebody who is fatigued, doesn't have any energy. They're restless, anxious, irritable, angry. This was a person who normally engaged in executive functioning, but now they're unable to concentrate. Drop in performance at school, work, changes in appetite, noticeable weight loss or gain, not being able to sleep, aches, pains, digestive systems, withdrawing. This jovial person now pulls away from everybody, not wanting to go out, wanting to isolate, doesn't want to get out of bed, doesn't want to brush their teeth, doesn't want to comb their hair, have expressed thoughts of, I don't want to be here. Life is not worth living. And a lot of times, these things happen after someone might experience something that has caused grief in their life, maybe the loss of a loved one. We know that grief is a reaction to loss. And so sometimes these are things that you may see when someone has experienced a loss. And guess what? When you have experienced an illness, that's a loss. Think about that a moment. When someone experiences an illness and they are no longer able to do the things that they formerly did, that is grief because it represents loss. And sometimes I think we miss that. And so then you may start to see that person who was always independent. Now they're having to depend on others. And so being able to have the opportunity to get support mentally is huge. And I want to talk about some of the different treatment options. Remember what I said, for a long period of time, we weren't sure how to treat mental illness. So people were locked away or excommunicated from their communities. But now we do have several levels of treatment options. The treatment option that I provide the most is talk therapy. Talk therapy normally takes place in an office. And the focus of talk therapy is recognizing and changing negative thinking patterns, learning skills to relate to others more effectively, learning how to manage life stressors. It's not one size fits all. And I often tell people, just like you shop for a physician, shop for the therapist that works with you. Shop for the therapist that you feel that you can connect with. There are many different approaches. A lot of times, especially now, I've noticed that a lot of people that are coming forward are admitting, you know what, I've never done counseling before. And so I will ask them, what made you want to talk to a professional? And they stated, you know what? I realized that it was ineffective trying to talk to friends and family. Because guess what? Friends and family are not equipped to be your therapist. Friends and family are not equipped to be your therapist. And so sometimes you will be given assignments in talk therapy that will involve art, journaling, hypnosis. A lot of my military community and others have animal assistance, biofeedback, dream analysis, music. The list goes on and on. So there's talk therapy, then there's medication. Now, someone at my level as a licensed professional counselor, I'm not credentialed to provide medication. That would be at the hands of a psychiatrist or your primary care physician. And a lot of times, the two will go together. In the office that I work in, there is a psychiatrist. So a lot of times, she would provide the medication management and then refer the patient to me for the counseling. The better combination is to have the two working in concert. Sometimes patients will say, I just want the medicine. Give me a magic pill. I want to be fixed, and I don't want to talk. I just want a pill. As I said, the two normally go in concert. There's also support groups that can be available, for different topics that might be going on in your life. We help you with the mind-body connection. There's mindfulness, meditation, relaxation, so that we can help you release physical and emotional tension. There are all different levels of care. There's outpatient, like I stated, office visits. Then there's intensive outpatient. Maybe you might be referred to MUSC's IOP, intensive outpatient therapy, or hospitalization, like the Palmetto. So there are different levels of care depending on what is going on in your life. So in closing, I'd like for you to know that a mental health challenge can occur for any of us at any point in our lives. I want to say that again. A mental health challenge can actually occur for any of us at any point in our lives. So I want you to work on finding meaning and balance in your life. Treat yourself well. Imagine your future self. Take time for things that you enjoy. Build meaningful relationships. And also, I just want to add that I am going to be working with COBRA. And so we have some prepaid sessions that are available, up to 6, for those persons in the program who want mental health support. At the beginning of my presentation, I stated, we must eradicate the silence around mental health. It is deafening. This ends my presentation.